Good day, students. In our class on RATS, I shall be taking leukemias for you people. This by itself is a vast and complex topic which students usually misunderstand or get confused with. I would advise you people to kindly be very slow and deliberate and follow each one of the pictures that are shown on the screen instead of just skipping them. I welcome you to today's class. Haematology RATS, Racing Against Time for Students in Pathology. As usual, a case history. A 30-year-old male presented with breathlessness and bleeding gums. On examination, he was anemic but not jaundiced. His values were as follows. Hemoglobin 7 grams, total count 1.2 lakhs per cubic millimeter, and platelets 70,000. What is your diagnosis? The key words are here: breathlessness, bleeding gums, anemia, no jaundice, and values total count 1.2 lakhs. So, what is your diagnosis? Platelets are also reduced. The diagnosis is AML, acute myeloid leukemia. Reasons are as will be shown. Subheadings are extremely important, and when you make any answer, see that all the subheadings are satisfied. Definitions are definitions. Acute leukemias are a malignant clonal disorders in which acute leukemias are malignant clonal disorders arising from hematopoietic stem cells. Each word is very important. Malignant clonal disorder arising from hematopoietic stem cell. And they consist of poorly differentiated blast cells. We shall be explaining these terms. Definitions are definitions, no own words, please. Earlier, it used to be just classified as acute and chronic, and each one of them will be divided into acute myeloid leukemia, lymphoid leukemia, chronic myeloid leukemia, and chronic lymphocytic leukemia. But now there is a variation. The usual presenting symptoms in a case of AML will be as follows, taken from the net. Classically, there will be an anemia. Any form of leukemia, the patient will be having anemia, resulting in shortness of breath, chest pain, compression, etc. Thrombocytopenia, and this can result in gingival bleeding, particularly in AML, M3, etc. Ecchymosis, epistaxis, menorrhagia. Tissue infiltration, due to which there will be a splenomegaly, hepatomegaly, and rarely a lymphadenopathy in AML. It is not very conspicuous. Leukostasis can lead to ocular defects because of obstruction of the blood vessels or cerebrovascular dysfunction. These are some symptoms. Please have it in mind. This is not the main answer. It should not constitute more than 5% of your answer. And this is a patient presenting with gingival bleeding. So undergraduates and dental students, you should be aware of this. So this is again a summary of the findings. There will be a low-grade fever, anorexia, bleeding tendency, pallor, bone pain because of the expansion of the bone, organomegaly, respiratory symptoms, gingival hypertrophy and bleeding, and these will be the incidences in that. Repetition is the mother of knowledge, and hence this repetition. The historical background. This is a gentleman, the father of modern pathology, Rudolf Virchow. And when he was examining a case, he saw something that was different, and he called it as Weiss's blood, which meant white blood. And it was not pyemic. It was not like neutrophils with toxic changes, etc. He was seeing something different. And then he called it a splenic leukemia because the patient was having a splenomegaly. Ultimately, it turned out to be a chronic myeloid leukemia, a historical landmark in pathology. There are other things such as chronic lymphocytic leukemia as well. Paul Ehrlich was another person who identified the staining methods to differentiate the different types of leukemias. And Nageli was a person in 1990 who introduced the term myeloblast. We are going into the etiology of the leukemias, which can be part of a question. So this is the Marshall Islands, and here there are a lot of this nuclear experiments that are being carried out. People thought that the effect of this nuclear experiments will be there for a few months and then disappear. But then later studies showed that the citizens as well as the children were carrying nuclear defects as well as the development of a leukemia. These are all telltales of human disaster. And this, of course, is the very famous or the notorious Hiroshima and Nagasaki, where the atom bombs were dropped at the end of World War II. And there was a total disaster, wrecking. But that was not all. After there was life, they found that leukemia, lymphoma, cancer, and disabilities grew along with them. Etiopathogenesis of leukemia can be part of an essay question, and this will be the panel of subheadings which you shall be attending to. It can be hereditary, as in the case of Fanconi syndrome, Down syndrome, ataxia telangiectasia, or Bloom syndrome, wherein there can be a leukemia. Radiation hazards, as in Hiroshima and Nagasaki, Marshall Islands, sometimes diagnostic X-rays, particularly in pregnant women, can lead to children with leukemias. Viruses, all of us know the Burkitt's lymphoma or the Epstein-Barr virus, the human T-cell lymphotrophic virus, HTLV-1, chemicals such as benzene. And paradoxically, you find that chemotherapeutic drugs used for the treatment of cancer, such as chlorambucil, can be leading to a leukemia. Chromosomal disorders. Translocation between 9 and 22 is the famous Philadelphia chromosome. Similarly, 15 and 17. And there are umpteen other chromosomal disorders which can lead to leukemia. Acquired disorders, PNH, paroxysmal nocturnal hemoglobinuria, myelodysplastic syndrome, and molecular syndromes. So these things you people should have in mind. Before I proceed further, I would like to introduce people to the various cells of the leukocytic lineage. Here I am finding a large cell, a large nucleus, and granules are not very conspicuous, a myeloblasts. Here nucleolus as well as granules are seen. It is a promyelocyte. Myelocyte, you find granules can be there, but nucleoli are not very conspicuous, as in this case, a myelocyte. This becomes a stap form, and then there is a mature neutrophil. This particular series we shall be having in mind, because for any form of leukemia, we should know this. And this indeed is the underline of today's class, the granulocytic maturation. So these are the various cells that ultimately form the granulocyte. A myeloblast, promyelocyte, myelocyte, and metamyelocyte, stap forms, and mature cell. These two are immature and they have got what are called as the primary granules. Primary granule we seen more in the promyelocyte. After which you have got the secondary granules. So here I can get a neutrophilic granule or a eosinophilic granule. Accordingly, the lineage will be there. So this is a particular one. You people should know the series of maturation. A myeloblast, promyelocyte, myelocyte, metamyelocyte, staph form, and the mature cell. What happens in the case of an acute leukemia is there will be A. Remember, acute leukemia is A, arrest is also A. So there is a maturation arrest. Here there is a maturation, this is arrested. I will not be seeing cells beyond the myeloblast and the promyelocyte. This is called a maturation arrest, which is seen in acute leukemias. So see this picture. We are bewildered. We will not know what it is. But I'm seeing a lot of these cells which are large compared with the RBCs with large nucleus. They are having cytoplasmic calculation. Whatever said and done, you find that these cells are all abnormal. And if at all you have got a doubt, you will have to compare. When in doubt, compare. This is a normal peripheral smear. Look at the number of leukocytes over here and also the number of immature cells, hardly any. I can find 2 or 3 platelets over here and here also, but here there is hardly any platelet. There is a thrombocytopenia. So compare the leukemia with the normal smear. This is a myeloblast. The myeloblast, you find it's a large cell. It has got a abundant cytoplasm. It has got a large nucleus. 2 or 3 prominent nucleoli are there. And in addition, the cytoplasm has got inclusions called the R.A.T.S. Increased NC ratio, large nucleus, prominent nucleoli, and a large cell, about 3 to 5 times the size of the RBC. This is classical of a myeloblast. 2 points in there will be the nucleoli in increased number, presence of R.A.T.S. So this is a description. I would like you people to kindly see this. And again the same picture, but I'm showing it for a different reason. You see this one. So this is what I call the hematopoietic stem cell. The hematopoietic stem cell is here, from which I can get cells of the myeloid lineage or the lymphoid lineage. From the myeloid itself, I get the myeloblast and the various series of mature cells. Sometimes there is also the erythroid series and the platelets which will be coming out of this. That is why in some types of leukemias, there will be increase in platelets as well as the RBCs. So this can happen in chronic leukemia. Now we are interested in an acute leukemia, and at this region there can be a maturation arrest. So follow this particular diagram. There is an arrest and there is a proliferation leading to increase in the number of blasts. Courtesy Alamy. IQ is equal to UQ. Whenever you see a blood picture, you describe it. It is easy. How do you describe a blood picture? There is a certain method of doing it, which we shall be seeing. And this is it. So always the hemoglobin of the patient, any form of a leukemia, hemoglobin is going to be decreased. It will be 10 grams up to 7 or 8 grams. But in later stages, it will be decreased. So hemoglobin. RBCs are usually normocytic, normochromic. Normocytic, normochromic. Later on, there can be an iron deficiency. WBCs are markedly increased in number. The count will be more than 1 lakh or even touching 2 lakhs. The normal count is 4,000 to 10,000 per millimeter. So there is a marked increase in count. And when I describe the cells, I find that many of the cells are immature. And describe each of the cell as I had told you in the previous slide. The blast, they are large, 3 to 4 times or even larger than that of the RBCs. The nucleus is large. There is an increase of the nuclear cytoplasmic ratio. And the cytoplasm is also abundant. There may be a kind of R.A.T.S or inclusion that can be seen. In this case, I am finding vacuoles in the cytoplasm, and we will have to do a cytochemistry to find out what kind of a leukemia it is. So describe. Platelets are reduced in number. In some cases, there can be polychromatic cells and normoblasts that are produced as a reaction. So when you describe, always go in that order, just like the examination of a patient. General examination and then systemic examination. Similarly, you find the general findings, hemoglobin, RBCs, WBCs in general, what is the count, etc. There is a maturation arrest. And then there will be the leukemic cells. Count is about 1 lakh to 2 lakhs. There will be more than 20% of blasts in the peripheral blood, 30% in the bone marrow. And describe each of the cells. Large cells, large nucleus, increased NC ratio, there can be inclusions of R.A.T.S, etc. And there is a maturation arrest. Not many matured cells are seen. Platelets are decreased in number. This is what is called as a FAB classification of leukemias. I would like you people to kindly by heart each and every word of this. Each and every word. So this is the typing over here. It is M01 to 7. And you will have to mention what the type is. Minimally differentiated, AML without maturation, AML with maturation, acute promyelocytic leukemia, acute myelomonocytic leukemia, monocytic leukemia, erythroleukemia, and acute megakaryocytic leukemia. And what you see in all of this, it is minimally differentiated or undifferentiated blast. AML without maturation, you will be finding only the myeloblast, nothing beyond. R.A.T.S are fewer in number. AML with maturation, I will be able to see the promyelocytes. R.A.T.S can be present. Acute promyelocytic leukemia, exclusively an increase in the promyelocytes, and it can be having increased granules. Phagots or bundles of R.A.T.S can be present. Myelomonocytic, both a combination of myeloid cells as well as monocytic cells are there. Monocyte should be minimum of 20%. And acute monocytic leukemia is there, in which we find the monoblast. Erythroleukemia, in which you find large erythroblasts or megaloblasts. Megakaryocytic leukemia, which is again resembling the megakaryoblast. Antiplatelet antibodies will be positive. And this is a panel of the cytochemistry of leukemias. Please by heart this. And I mentioned where it is positive. Myeloperoxidase is positive in the first two. Third also myeloperoxidase is positive. Wherever there is a myelocytic series, you'll be finding either the myeloperoxidase or the Sudan black, which is positive. Monocytic, you'll be finding the non-specific esterase. Non-specific esterase can be present. And acute erythroleukemia is PAS positive, and platelet peroxidase is positive in a case of megakaryocytic leukemia. This entire tabular column you people should write whenever you are asked a question on AML. There is another method of classifying, which is called the WHO classification. WHO classification is this. There are 7 points in it. I find that there are recurrent genetic abnormalities, myelodysplasia related changes, therapy related neoplasm, acute myeloid leukemia not otherwise specified, myeloid sarcoma, myeloid proliferation related to Down syndrome, and blastic plasmacytoid cell neoplasm. All these things you people will have to write. So there are 2 methods of classifying. In WHO, there has to be 25% blast, whereas in FAB classification, that should be 20% blast in the peripheral blood. So this is important for us. There are 2 types of leukemias basically. One is called a myeloblastic leukemia, another is called a lymphoblastic leukemia. So there has to be a difference between the lymphoblast and the myeloblast. The differences are given here. I would like you people to kindly memorize it. If you are an intelligent student, you can make use of this table in an answer for a lymphoblastic leukemia, myeloblastic leukemia, or both. Anyway, the basic point will be myeloblast is a large cell. It has got slightly convoluted nucleus Nucleoli will be more in number, whereas lymphoblast is round, it has got a basophilic cytoplasm. Basophil means blue, and 1 to 2 nucleoli. Sometimes it is not prominent at all. So these will be the differences. You will have to read this. And this is the cytochemistry of leukemias. It is the repetition. Sometimes this itself will be a question for you. And these are all the various types of leukemias. M0 to M7, then there is a lymphocytic leukemia, there is a hairy cell leukemia. And the plus are all the positivities which you will have to mention. For example, TRAP, a very frequently asked MCQ. Tartrate resistant acid phosphatase is positive in hairy cell leukemia. Periodic acid shift is positive. You get what is called as a block positivity in ALL. It is granular positive in a case of erythroleukemia. Myeloperoxidase Sudan black, wherever the myelocytes are there, it is positive. So kindly read this up. This is a chloroma. A chloroma is one wherein there is an infiltration of the soft tissue by the leukemic cells. It is called chloroma because it resembles the chlorophyll. There is a greenish tinge in it. And it is because of a myeloperoxidase that is there in the leukocytes. And when we study the soft tissues, I find that there are infiltrations into the soft tissue. When we look carefully, we find cells that are present or undifferentiated cells, and it is called a chloroma. It is a tragedy that patients suffering from leukemia will have to fight back. Here there is a young child, and specifically I have chosen a picture of a young child because in lymphoblastic leukemia, young children are affected, whereas myeloblastic leukemia, any age can be involved. So this is a picture of an ALL where I am finding small dark cells, but still it is much larger than the RBCs. Nucleoli are not prominent, and the nucleolus is round and hyperchromatic. These are the differences compared with the myeloblastic leukemia. And these are the differences between ALL and AML. Kindly by heart this one. Age more common in children. This is present in children, adolescents, and adults. Lymphadenopathy is common in ALL, not seen in AML. Meningeal infiltration is more common in ALL, less in AML. And mediastinal lymphadenopathy seen in T form of ALL, not seen in AML. And this is from my book, one page. And as I told you earlier, describe. So I am finding an increase in the leukocytic series. All the cells are immature. They are large. They are having abundant cytoplasm. The nucleus is large. It is convoluted. There are prominent nucleoli. These pale areas are the nucleoli. Is it clear? The nucleus is convoluted. It is not round. And sometimes there can be inclusions such as R.A.T.S which are present. Look at this picture over here. There are some R.A.T.S which are present in the cytoplasm. And usually we identify one cell by the company it keeps. Identify a person by his company. This is again a lymphocytic, AML, the FAB classification. This one you people can memorize and add the cytochemistry onto it. More than 30% blast should be present in the bone marrow, 20% in the peripheral blood. And this is a picture of a bone marrow aspiration. Usually it is not done in a case of a leukemia to diagnose a leukemia. But there is a condition called a subleukemic leukemia or aleukemic leukemia. The count will be low, but the patient will still be having a leukemia, wherein we centrifuge, we separate the WBCs. This is called the Buffy count. From this, with the pipette, we take out the cells and make a smear. You will be able to see a large number of blast cells. This is a Buffy count preparation that is used in a case of subleukemic leukemia. And there is also a condition called as aleukemic leukemia. Without leukemia, we say it is leukemia. But when we do a bone marrow aspiration, lot of immature cells can be present, more than 30%. So these types you will have to mention. Why there is no blast in the peripheral blood is patient is undergoing treatment. Sometimes to find out a residual lesion, you will have to do a bone marrow aspiration. So these are the things that you people will have to remember. It is a preliminary class and we shall come back later. Gracias.